and we'll get started in 1 more minute. Oh.
Okay, now the Brown, Desmond Brown. Okay, CBC.
Oh, thank you. All right, if everyone's ready, we'll get started. We're streaming live. So thank you for joining us today. It is Tuesday, June 30th, and you're at another media briefing. Today, we will have statements from all 3 of our panel members. So we have first up, Acting Medical Officer of Health, Dr. Hsiu-Li Wang, followed by Regional Chair Karen Redman, and we also have an enforcement update from our CAO, Mike Murray. So without further ado, I will pass it over to Dr. Wang. Go ahead, Hsiu-Li.
Thank you, Bethany. Sorry. As of this morning's update, we have added a new feature on our dashboard. You can now see the distribution of cases by neighborhood across Waterloo region. The map gives the option to filter for outbreak-related or non-outbreak-related cases. Neighborhoods with 5 cases or less have not been published on the dashboard to protect personal health information. You will notice that 2 neighborhoods stand out due to the influence of long-term care and retirement home outbreaks. As I mentioned, the map has the option to allow you to see the rates excluding the influence of outbreaks. And you will see that the rates are much more even across neighborhoods when they are excluded. We are cognizant of the fact that attention can be drawn to an area that has more cases. It can create an erroneous impression or stigma that that's where the virus and infectious people are. So I'd like to be clear, all areas of Waterloo region are affected by COVID-19. This map represents positive cases in terms of where they live, but exposure to cases could happen anywhere in the region. In addition, the number of positive cases in our region and in each neighborhood has been significantly influenced by testing guidance, especially in the earlier stages of the COVID-19 response, where testing was limited to only certain groups and settings at greater risk, such as long-term care home and retirement homes. So areas with lower rates of COVID-19 should not be considered safer. It should be assumed that the risk of acquiring COVID-19 is present throughout the region, and we have to practice the recommended public health measures everywhere in the region. In terms of overall trends, we continue to see cases reported, but overall the status of COVID-19 in our community remains stable. We now have 89 active cases in the region. The percentage of those who tested positive has continued to decrease. A total of 34,418 tests have been performed in Waterloo region, with positive results for approximately 3.7% of all tests. Testing volumes have continued to increase. The process for collecting this data involves connecting with each of the assessment centers for the aggregate test numbers, and we may not receive daily counts. We may receive numbers for multiple days. Therefore, to better manage the time needed to refresh this indicator, going forward, it will be updated on the dashboard on Tuesdays and Fridays going forward. So you see that that indicator is a little bit highlighted in gray. And if you hover over it, it says will be updated Tuesdays and Fridays. So a total of 1,094 cases, or 84% of positive cases in Waterloo region are now resolved. Outbreaks in long-term care home and retirement homes are also stable. There is currently one outbreak in this type of setting. The outbreak at Forest Heights has been declared over. Although there were recently 4 additional staff cases picked up as part of very close monitoring and increased testing of staff in long-term care homes, we've carefully assessed these cases and do not believe they are associated with a risk of ongoing spread. All other recent tests on residents and staff have not identified further cases. The outbreak has been well controlled for a few weeks, and the outbreak is now over. We currently do not have any active outbreaks in other congregate settings or workplace settings. Sadly, we have had a recent COVID-19 related death in our community. I wish to express my deepest condolences to the family and loved ones. It is sadly not unexpected, given the continued circulation of the virus, which we know has the potential to cause serious illness and death, which is why I continue to ask our residents to follow all public health measures to continue to slow the spread of COVID-19 in our community. In closing, we must not let up. Physical distancing, wearing a mask when physical distancing cannot be guaranteed, hand washing and self-isolating and getting tested if we develop symptoms. The virus is spread by people and it can be prevented. With Canada Day tomorrow, it is also essential that people continue to follow the provincial order with respect to gatherings and not gather with more than 10 people. Even at such gatherings, physical distancing must be maintained between anyone from different social circles, or sometimes called household bubbles. When distancing cannot be maintained, masks are strongly recommended. The health and well-being of our community depends on everyone doing their part, being kind and considerate to each other, and helping one another practice these measures and living our new normal. Thank you.
Thanks, Hsiu-Li. I will pass it over to Chair Redman. Go ahead, Karen.
Thanks, Bethany. Tomorrow is Canada Day. Celebrations will look a little different this year due to COVID-19, but there's still lots of innovative celebrations happening online. All of the regional municipalities have worked hard to plan creative virtual events, including concerts, parties, and interactive activities. Check out your local city or township website for details. I plan to watch the Government of Canada's virtual fireworks at 10 p.m. local time. You can point your phone or tablet to the night sky wherever you are in Canada, and a 3-minute 3D fireworks display will begin. No matter how you celebrate tomorrow, it's still very important that we follow public health guidelines on socializing. Please remember, bubbles or social circles are not the same as gatherings. Your social circle, you choose contacts, and you can only be part of one social circle. You can gather up to 10 people not in your social circle, but you must maintain physical distance. Wear a mask in situations where physical distancing may not be possible. Whatever you choose to do this Canada Day, please celebrate being Canadian. Please be safe, and remember that you can sing "O Canada" while you're washing your hands, because that's the requisite time it takes to make sure you've done a good job. Happy Canada Day, everybody.
Thanks, Karen. Maybe you can sing for us later. I will pass it over to CAO Mike Murray. Mike's not joining us on Friday, so I believe he's going to give a brief enforcement update now. Go ahead, Mike.
Thanks. Yeah, so do a really quick enforcement update because I'm not going to be able to join the briefing on Friday. So over the past week, so this is the period from June 23rd to June 29th. In terms of site visits that involved educations and warnings, 142. Site visits with no action required, 154. And 2 new charges laid this week, one by the City of Kitchener and one by the City of Waterloo, both at private residences and both for gatherings of more than 10 people. And so I think this just reinforces what Dr. Wang was saying and Chair Redman, that the emergency orders are still in effect, they are still being enforced, and the emergency orders do limit public gatherings to less than 10 people. So I just encourage everybody to take the emergency orders seriously and take their personal precautions seriously. Over the Canada Day and into the weekend, our enforcement partners will continue to be out and about. And so our encouragement is to people to take these measures seriously. Thanks.
Sorry, everyone, can you hear me? I had a pretty big breakdown there, so I apologize. I'm back and I will pass it over to the media for questions. Let's start with Namish, go ahead.
Here's questions for Dr. Wang. I'm just going to ask about the map and wondering if you think there is going to be any complacency among some of these lower density regions in terms of COVID-19, and just wondering what you would like to tell people in terms of that, and not letting up in terms of their I guess prevention of the virus.
Sorry, so what we see from the map, even though it has been heavily influenced by testing guidance that limited testing to only certain groups for most of the first wave, what we see is still the fact that there are cases in all neighborhoods and across the region. And so, and we can see that on the other page where we have the rates of cases by municipality, which has been there for a while. So my message would continue to be that people have to assume that anywhere they are in the region, they could acquire COVID-19. And the best way to protect themselves is to follow the recommended public health measures.
Is there any thought to adding active cases to the map, or is it going to stay pretty much how it is?
Right now, it's the way that it is, but we know that 84% of our confirmed cases are now resolved, and we expect that for a large number of people, they will be able to resolve within 14 days. So I think people should just keep that in mind. Of course, there will be serious complications and deaths as well, but otherwise, if people do recover, they usually will recover within 14 days.
And a question, just one question for Mike Murray. Is that 23 charges? Is that am I right on those numbers in terms of the restrictions?
You are absolutely correct. Excellent math.
Thank you. All right, that's all my questions.
Okay, thank you, Namish. I will pass it over to Nicole from CTV.
Hi, good morning.
Hi, Nicole.
My message is for Dr. Wang. Yesterday, we heard from public health officials in the London area. They found that 8 people who contracted COVID-19 were in their 20s and went to 2 parties in London and to parties in Waterloo region. Is Waterloo region helping out with that contract? And has anyone from parties, anyone who attended the party here in Waterloo region, are any of them the ones who have tested positive?
Well, thanks for the question, Nicole. So yes, we have been referred a small number of contacts who live in our area, and we are in the process of following up with them. And at this point, we do not have any confirmed cases to report.
Since they were at large gatherings of more than 10 people, have the people who have held the parties in Waterloo region then, have they been charged?
Well, we would have to, if we had evidence of that, then the charges would be a consideration, but we were referred a small number of contacts from Middlesex London, and we are following up on the contacts.
But if I could just to reinforce the two charges, I believe are completely unrelated to the issue that you raised. But what it does highlight is there have been charges laid in Kitchener and Waterloo within the last few days for gatherings of greater than 10 people at private residences.
This yesterday, the term super spreader events, that's the term that's being called for these parties. You know, it's Canada Day tomorrow. Many people are off for the rest of the week and patios are open. Weather is going to be nice. Are you giving out a stern warning, perhaps about not recommending going to phase 3 if we see these quote unquote super spreader events in Waterloo Region over the next couple of days?
I will do what Chair Redman and Mike have also done in the past, which is, you know, I think I'd rather not speculate on what might happen. So obviously it's important, you know, as we go into Canada Day, that people remember that we cannot let up our measures, that we cannot be lax on those. And as we've seen in Middlesex London, if people don't follow those recommendations, there can be spread of COVID-19 to a number of people. And so this is a virus that we always have to, you know, carefully try to prevent from spreading. And if we have evidence of spread, you know, work quickly to try to stop it. So really, you know, would like to request that our community continue to do what they've been doing, which is helping us slow the spread by practicing those recommended measures.
And Nicole, if I can just add, on a previous press briefing, one of the media asked us if we were looking at Kingston as a best practice, and the fact that they had a very, very low incident, and now they've seen a spike. So it's a good cautionary tale to all of us that it can turn on a dime and that it spreads throughout the community. So we need to be vigilant, and we need to rely on our community to put the greater good of the community ahead of their own desires and do the things that public health has been telling us all along.
Can you provide any details in regards to the latest death? Because it wasn't at a long-term care setting. So I'm just wondering,
Sure.
You know, how old the person is and whatnot.
Sure. This is a person that was in their 80s and was a community case.
Sorry, I'm muting myself in between because I've got kids. Can you talk, we have seen on social media, biostatistician, I hope I'm saying the name right, talking about transmission rates. And I think today was the first time that Waterloo Region went below the number 1, which I think is,
No.
Are you able to provide details about what the transmission rate is to your knowledge here in Waterloo Region?
Yeah, no, it's not the first time we've been below 1. We've been below 1 most of the time in the last few weeks. Sometimes if there are blips in cases, we'll go slightly above 1. But when we're looking at a relatively small geography like Waterloo Region compared to the province, you know, those numbers can fluctuate more than if they were spread out over a larger population like that of the province. But no, Waterloo Region has been below 1 for a number of weeks, but sometimes it can go above 1 for you know, temporary periods. If we have, for example, a workplace outbreak. I think that's the last time we were above 1, when there was a workplace outbreak and we had a number of cases associated with that. Well, then our numbers go up. So no, I think in terms of our spread in the community, it's what we've been seeing in the last days and weeks, which is, you know, we're continuing to see stabilization of our rates and relatively low rates now compared to where we were earlier.
Thank you for that clarification. Last question, is St. Mary's still managing Forest Heights For how long, how much longer, do you know?
The management order that was put in place by the Ministry of Long-Term Care was for a period of 90 days. So I don't know exactly where they are in the 90 days, although that could also be prolonged if the ministry felt that was needed. So for any more questions about that, I would probably refer you to the president of St. Mary's. I believe they are ready to respond to questions about the Forest Heights situation.
Okay. That's it for now. Thank you.
Yes.
Great, thanks, Nicole. I will pass it over to Damon. Go ahead, Damon.
Hi, so my question is for Dr. Wang. Canada Day is more than like that we've seen. What warning should we put out to the public? And do you have concerns about spread when people go to their cottages up north and come back, and et cetera?
Yeah, I would just like to reiterate what Chair Redman said about respecting the social gathering rules. You know, both the limit to gatherings up to 10 or less, and if you're in a social circle, making sure that it's not more than 10 in your social circle, and that it's the same people, right? So for example, if you are in a gathering with up to 10 people, but 6 of those people are not part of your social circle, whose members doesn't change, then you have to physically distance from those 6 other people in your gathering. So it's to make sure that, you know, people can celebrate Canada Day. They can have get-togethers up to 10, but they need to continue to practice those social distancing rules when they apply. Like if they are gathering with people that are outside of their social circle, whose members remain always the same.
And then my second question is, with the map and all these breakdowns now available to the public, is there concern for greater fear for someone like the regions like Woolwich, Rural North, that has 298.1 rate per 100,000? Because that statistic seems pretty daunting.
Yeah, no, that statistic, as I mentioned, is reflective of, you know, where testing was prioritized for most of the pandemic to date, such as specifically in long-term care homes, retirement homes, group homes, other more vulnerable settings. So we are going to see the cases be heavily influenced by that. And that's why there's also that option to filter out the outbreaks. If you want to take a look at the rates for non-outbreak related cases, and you can see that's much more even across the region when you filter out the outbreaks. So really the message is not that there is one area of the region that's more at risk than the other. The message is that it's everywhere across our region, and people need to take precautions everywhere.
Okay, that's all. Thank you.
Thanks, Damon. I will pass it over to Tim from 5-7. Go ahead, Tim.
Good morning, Dr. Wang. With the new map, was this part of this creating the new map? Was this because we heard a lot about communities asking to see how many cases were in their region? Is this part of that, or is it just because to gain more information for public health?
Yeah, you know, there were some larger health units that produced maps like that: Toronto, Hamilton, Ottawa, and there was a request for mapping like this. You know, we have a lot of cases now, and we can start to look at, you know, if there are areas in our region where, you know, we might need to potentially look closer if you know, if it's seemingly associated with increases that aren't easily explained. But when we did our mapping, and the results of which, you know, we all see now, we have noticed that really it's the correlation with the outbreaks that's showing up. There aren't other correlations that we can see, with other factors, and so that kind of mapping, and which will continue to be updated. That map will continue to be updated as our cases are updated. Will allow us to continue to monitor whether there are any particular areas that have more cases for reasons that are not easily identified, and whether or not we need to look into that a bit more.
Now, how was the process of developing the map? Did you have to contact other departments in Region of Waterloo, such as geographic information systems, to be able to develop it? And when you continue to update it, will it be more difficult to continue to add to this map?
Yeah, and unfortunately, we're using the software Tableau, and so we're able to update the map as we update our case counts. So that's just part of the software, and it shouldn't be that difficult to keep updated for that reason. We did consult with experts in our regional municipality who work in the planning department for population health estimates, because they're the experts for that. And so they supply the denominator information. But sometimes we also have, conventions for denominator information from the province. And so I'm sure we consulted with our regional planning department to make sure that we were in line with them, as well as, the province if needed.
Okay. And there was a case over the weekend. It was listed as, or still listed as, a result of travel. Does this pertain to domestic, international, or regional travel?
It generally would mean they have come from a place where there is a known transmission of COVID-19. I'm trying to remember, trying to see if I can remember. I'd have to probably get back to you on that to be sure. So I'll have to get back to you on that. But generally in the past, it has been associated with travel outside of Canada, which has continued to be permitted. It's just that non-essential travel is not recommended. And if you return from travel outside of Canada, you are automatically under a 14-day quarantine order from the federal government.
Those are all my questions. Thank you so much.
Oh, I think, Bethany, you're still on mute.
Sorry, I'm having all sorts of trouble today. Thanks, guys. I will pass it over to Joanna. Go ahead.
Hi, Joanna.
Just a couple questions for Dr. Wang. At Forest Heights, are the measures that are in place, that were put in place during the outbreak, are those going to stay for a while, or will there be an easing of those now that the outbreak is declared over?
Yeah, there will be a careful easing of those. St. Mary's is very much directly involved now, and we are in regular daily communications about those things. So now that the outbreak is over, they can remove the outbreak measures, but there will still be in place strict infection prevention and control measures to continue to control, to prevent and control further spread if there were to be further cases in the future. There will be, the restrictions for visiting will also now be allowed to be lifted as a result of the outbreak being declared over. And I think St. Mary's is going to have more information about that. So I'll let them speak to that. But yeah, we want to be careful that even though the outbreak is over, we are still putting in place, careful measures to prevent further transmission of this virus in this setting, like we would do for other homes in our region.
Okay. And as for the neighborhood mapping,
Mm-hmm.
do you see something like an advantage to having that for you guys, or are there things that you're sort of nervous about with sharing those public?
Yeah, well, I am always nervous about the unintended effects of showing rates at relatively small geographies like neighborhoods. I'm concerned about the potential for, differences in rates to stigmatize neighborhoods. That's why, I've been trying to really make clear that, first of all, the testing guidance that we had greatly influenced the number of cases that were detected, and so there was a heavy influence from outbreaks in long-term care and retirement homes on rates in neighborhoods. And so I just want people to understand that it isn't because one neighborhood is riskier than another. We know that COVID-19 is across the region in all neighborhoods, and everyone needs to continue to assume that they could get it anywhere. And practice the recommended measures.
And just one last question about the death reported yesterday. Was that, I guess, kind of a stark reminder for public
Yes.
health and probably the community after going so long without having a death?
Yeah, obviously, it was sad to see, and I wish that there, wouldn't be any more added to our total number of deaths, but there was, and there might continue to be as we continue to have cases. And so it is, like you said, Joanna, it is a stark reminder that it can have very severe, the most severe consequences. And so it just, I think, reinforces the importance that we don't let up on our fight against COVID-19, that we continue to employ all the measures that we need to prevent the spread of cases.
Thank you. Those are my questions.
Thanks, Joanna. Over to Kevin from Global.
Hi, this is for Dr. Wang. Just to follow up, the London party, the contact list you were given for people in the Waterloo region, they haven't all been tested yet. It's just been you've just got that list to work from so far. So it doesn't mean there will be no case, it's just none so far, right?
Yes, that's correct. We're following up on contacts, but when we reach contacts, we have to also assess the typical things we do, which is the type of exposure. And yes, if we feel that they've been exposed, we will recommend that they go get tested. So that's correct. At this point in time, we do not have any cases associated with that outbreak in London, but we are following up with the contacts that we have been referred from London.
And this question's for Mike. If you guys did find out retroactively that the Waterloo party had 15 people or whatever at it, it's not like you can go back and ticket them, I assume.
Yeah, I think you're totally correct with that. Yeah, there's real requirements around evidence and what evidence you need to lay a charge, and I think it's typically direct observation by an enforcement officer.
Yeah.
That's it for me. Thank you.
Great, thanks, Kevin. We do have a question from Desmond. I'm not sure, Desmond, do you want to try your mic? I don't think it's working. I can read your question over chat. So this is for Dr. Wang. Can you share which long-term care facility is still experiencing an outbreak, and what's the situation in terms of numbers?
Oh yeah, so the one home that is still an outbreak is Sunnyside, but they are stable. They are currently stable, and so we'll continue to monitor, but they haven't had an increase in cases in the last few days.
Great, thanks, Hsiu-Li. Okay, I am going to take a look to see if there are any follow-up questions. So I'm working on multiple screens. I see Nicole. Go ahead, Nicole.
Yeah, Dr. Wang, are you able to quantify how many people you're following up with in regards to the London party and perhaps the Waterloo Region parties?
3.
And final question, you know that next week staffers are supposed to come with the report in regards to mandatory masking. Since I guess we last spoke, are there any additions that you suggested in regards to the draft bylaw?
So maybe I'll just make a general comment, and then Dr. Wang or Chair Redman might want to jump in. What I would say is there is work going on as we speak on that bylaw. It's relatively simple to say we want to have a bylaw that requires masks in certain indoor settings. To actually put that into the form of a bylaw that's has some legal force and is clear and understandable and enforceable, that actually takes a fair amount of work. So that work is going on as we speak. The hope, the intention is that we'll have a staff report with a bylaw attached to it that will be released on Friday in advance of the special council meeting on Monday afternoon. So there will be opportunity for the public to have a look at the report, have a look at the draft bylaw, and if they want to provide input to regional council before the meeting on Monday afternoon.
Yeah, that was perfect, and I don't have anything else to add.
And if I can just jump in, Nicole, I would say that we have certainly consulted with Dr. Wang, but very clearly this is a municipal bylaw that we're bringing into force. It's not an order through public health. And there's a variety of views that were expressed both at regional council, and a whole bunch of members of the community have reached out with very firm views on either side of this debate. So we will move forward with a bylaw making masks mandatory. The devil will be in the detail. We don't know what that is as yet. Personally, I feel very strongly that the community needs to be aware that this bylaw is coming in, and there has to be a large component of education as we go forward. Just to reiterate, we have always looked at enforcement of public health guidelines as education and compliance, and we will continue to use those two instruments rather than ticketing immediately to get people to, again, protect others.
So on Monday, is it possible there could be a vote, and perhaps would it come into play immediately, or you would give a week's warning in regards to making masks mandatory?
So that bylaw will come on Monday. It will be in the hands of council to review the bylaw, make any changes as they see fit, and they will establish when that bylaw will come into force. Typically, there is a period of time where there is public awareness that is part of the education program, and I understand that there are municipalities that are sort of doing them next day or within 24 hours. We'll have to see what council decides to do with the bylaw in Waterloo Region.
Great, thanks, Nicole. I'm just looking, anybody else? Okay, I see Damon. Go ahead, Damon.
And anyone can answer this one. I'm just wondering if it's a little late for the call for a bylaw for mandatory masks. We've been in pandemic for a couple of months now.
So I would tell you again, Damon, I don't think it's too late. We're not through the pandemic. We are into phase 2. We don't know what criteria or when we will, what the province will decide is the criteria to go into phase 3. So we're still waiting to see that. But we don't have a vaccine. We don't have a cure. So this is a long-term strategy, which is one of the reasons why I really do support the fact that the council in Waterloo region has done it thoughtfully. And again, there's lots of debate on both sides. There's science on both sides. And we're moving forward with what we think is a defensible strategy. And again, we'll have to see what that bylaw looks like, but it's not too late. And it's never wrong to make sure that you're bringing the public along with you when you make these decisions.
Okay, last call. Any final questions? Nicole, go ahead.
Sorry, Chair Redman, you mentioned that the draft bylaw will be made available online on Friday. Will it be made available prior to the media update so we can ask some questions, or will you guys be made available once the report is out?
I think that's a
Yeah.
Mike Murray question, but certainly happy to talk to you if it happens afterwards.
Yeah, I think I actually don't know when in the day that report and bylaw will get released. I mean, typically, I think we post our agendas in the afternoon, and it would probably be, following our typical afternoon, public release of a council agenda. So yes, it may not be before the media briefing. And then I think, if there are questions, as Chair Redmond said, you can work through our communications team and arrange interviews.
Okay, great. I think that is it for questions. So thanks everyone for joining us, and thanks for your patience with my technology. We will wrap it up and we'll see you again on Friday.
Happy Canada Day, everybody.
Canada Day.